today I want to talk about hair loss because I've been getting so many questions lately from both men and women asking about how to take care of their hair loss. So I'm going to run through some of the most common options on how to take care of your hair loss because honestly, no one wants to lose their hair, especially not me. So if a patient comes in to see me and they are either a male or female, I first approach them and say, listen, we have natural options for you and we have medical options. Let's talk about all of them and let's see what you would prefer. And by the way, anyone who has questions during this session, please add them, share your comments, and I will definitely answer them as best as I can. So for females, it's definitely a bit tricky, especially if you are someone who is either pregnant or breastfeeding. You may be experiencing some sort of hair loss. And if you're pregnant or breastfeeding or planning to get pregnant, I always recommend taking the natural options, which is typically using hair vitamins. If you are pregnant, you should actually see an increase in hair growth because you're having an increase in hormones and estrogen, which is helping your hair grow. So now if you're not pregnant and not breastfeeding and you're a male or female, what are the options for you? Let's start with the topicals. So, hey, shout out to Jess. So I like to start with topicals because especially if you're someone who's never used oral medication or you're just not someone who takes a pill every day, asking someone to take a medication is asking a lot of them. So I like to start with minoxidil, which is often known as Rogaine. And I always tell my patients to do the 5% foam because the foam doesn't have an ingredient called propylene glycol in it, and propylene glycol can cause your scalp to be very itchy and irritated feeling. So always go with the foam. And whether you're male or female, the 5% is the way to go. Don't fall into the marketing ploy that says women's, because women's is just a way to put a pink tax on the medication so they can actually charge more of a tax for women to buy it. Men's is just as safe for women to use. And again, go with the foam. However, using minoxidil requires you to be compliant. So you're going to have to use it at least once a day, if not twice a day, so morning and evening. And yes, it is like brushing your teeth. You're going to have to keep up with it if you really want to see results. And for some people, that's a lot to ask, and they don't want to have to do something and put something in their hair all the time. And I can relate. I tried to use minoxidil topical foam, and I was doing really well with it for a while. But after a while, I was like, I don't want to do an extra step in my routine, or this is making my hair look oily, and I'd much rather just take a pill for any hair loss. So there are minoxidil pills that we prescribe, and minoxidil actually was originally a blood pressure medication, and we found that it caused hair growth. So now if you are just overusing topicals and you'd rather take a pill, we have a oral form of minoxidil. But I do want to tell you that if you're a female, one of the most common side effects I see in my patients is they complain of increased hair growth in the chin area. So that's going to mean that you're going to need to pluck more hairs or get your chin hair waxed more often. But you have to kind of outweigh, like, is it more important for you to have more hair on your scalp and where you can take off this hair with tweezing or waxing? So you kind of have to weigh that benefit and risk. And other than the increased hair growth for women, sometimes people complain that they get some edema or swelling in their ankles, or they may feel a little bit lightheaded or dizzy, because remember, it is a blood pressure pill. But the way I counsel patients to use this medication is take it at night and take it with a full glass of water. That way you won't experience any change in your blood pressure that it may be causing. So that is a great place to start with oral minoxidil if you are not into the topicals. Now, say you're someone who came in and you're like, I've already tried the minoxidil and I'm getting some increase in hair growth, but I still want more. Then there's other options we have for you. Some of these are spironolactone, which actually is safe in both men and women. And I really like spironolactone if you're someone that has PCOS, polycystic ovarian syndrome, if you're someone who has dealt with hormonal imbalances during your life, and if you're someone that has androgenetic alopecia, then spironolactone is a great option for you. Men can also use spironolactone as well at low doses. Now, some of the common side effects with spironolactone are women complain that they have menstrual irregularities. So sometimes they have like breakthrough bleeding, or their menstrual bleeding is different than typical. They often complain of breast tenderness sometimes. And then again, because this is a diuretic and it's an anti-androgen, it can change the potassium levels. So if you're feeling dizzy on it, I recommend taking it again with a full glass of water to avoid that feeling. Again, taking it at night, but be aware that it can increase your urination frequency. Okay, so we've covered topical minoxidil, we've covered oral minoxidil, and we've covered spironolactone. There are other options, and please, if you're just joining now, feel free to leave your comments and questions. I'm happy to answer them for you. So finasteride, which I'm sure many of you have heard of before, it's also known as Viagra. There's also dutasteride, which is like the sister or brother drug of finasteride. So these are two other great options. These are 5-alpha reductase inhibitors. That means they reduce and decrease the levels of DHT, which is causing our hair loss. So if we can decrease that DHT, we can get more hair loss and less thinning hairs. So finasteride, again, is a pill that you would take every day, or dutasteride is a pill you would take every day. But some of the common side effects that people may experience with finasteride or dutasteride is erectile dysfunction or decreased libido, so decreased sex drive. If you're someone that does not experience those side effects with finasteride and you're still not at your goal of what you want your hair growth to look like, then I recommend bumping to the dutasteride because it actually has double the efficacy of finasteride. It works 2 times stronger than the finasteride because it binds at on the molecule, it's binding at 2 places rather than just at 1 place like finasteride. However, you have to keep in mind with dutasteride, because you're binding at 2 places on this molecule and you're working 2 times greater it's 2 times more efficacious, you have a higher likelihood to get a side effect with the dutasteride. However, it's often that my patients don't have any side effects with dutasteride or finasteride, or so mild and they are just so happy with their increase in hair growth that it's worth it. So these are some of the medical options available for patients with hair loss. If you are someone that is already taking these medications, or you're just really adverse to taking anything that's medical and you're worried about the side effects, we have other options for you. And those include doing low-level light therapy, which you can get either a red light cap or a comb. However, that requires you to be very compliant. It's something that you have to do frequently throughout the week, and you may just not have time for that in your schedule. But it is shown to help hair growth, because the way that we believe the red light therapy works is we know that it decreases inflammation, and also it stimulates hair growth and growth factors into that area. In addition to the low-level light therapy, I like something called mesotherapy. So you may have heard of PRP, which is when they draw your blood, they spin down your blood, they take the plasma, and then they inject the plasma into your scalp. So the idea behind this is that when you're injecting the PRP, the plasma, into your scalp, you're making tiny little microinjections. And these microinjections actually cause microtrauma, which stimulates growth factors into that hair follicle area and stimulates hair growth and decreased inflammation as well. And we believe that this is very effective. I personally like mesotherapy, which is again causing this micro trauma. But instead of using plasma, you're using medication like dutasteride, finasteride, or other medications, and you're actually just putting it in just to the base of your hair follicle. So not that much of it is getting absorbed into your bloodstream. So you're likely to experience far less side effects than if you were to take it with an oral medication. I do want to mention, and it's a question I get asked all the time, is what do I do? I've heard that if you stop minoxidil, that my hair's gonna fall out. Yes, be aware that in the beginning, when you first start using topical minoxidil or topical Rogaine, you can get an increase in hair shed. And this shed usually lasts anywhere from 4 to 8 weeks. It is alarming and it's concerning and it can freak you out, but don't be freaked out. Don't be concerned. This is actually a really good sign. It means that the medication is working, and because you're making room for new hair growth to come into that hair follicle. So know that you will get past that shed and you'll start to see really great results. But again, hair takes time. It takes 3 months to see any progress. Be patient. And if you're someone that needs help and you're curious or want treatment for hair loss, you can find me at dermondemand.com. I have a whole program for hair loss, and I can work with you to customize it to your own needs and to help you reach your goals with your hair loss. Again, I will share that link below. It's dermondemand.com. And if you have any questions, feel free to reach out to me on social media, on Instagram, Twitter, TikTok, and you can also find me on YouTube. I will be coming out with more videos in the new year, so stay tuned for those. And I hope you found this helpful.